All right. It's my pleasure to have with us here this morning Dr. Glenn Stimmel, who is a professor of clinical pharmacy at the School of Pharmacy at USC, University of Southern California, and also a professor in the School of Medicine, and was previously an associate dean for academic affairs at USC, and was also served as interim dean. And he is a pioneer in psychiatric pharmacy. He's considered by many the father of psychiatric pharmacy. He's a founding member and past president of the College of Psychiatric and Neurologic Pharmacy. He's a founding member of the American College of Clinical Pharmacy. He's past chair of the BPS Specialty Council on Psychiatric Pharmacy Practice. He served on the board of directors of AACP. He's a very prolific scholar in psychiatric pharmacy, and he was recognized as a distinguished alumnus of UCSF School of Pharmacy. And he's also been recognized with a Career Achievement Award for the College of Psychiatric Neurologic Pharmacy. So it's our pleasure to welcome Dr. Stimmel. So we'll go ahead and we'll start off. I'd like to ask you, first of all, we'd like to learn more about your journey in your career as you developed as recognition as a leader in psychiatric pharmacy. And when reflecting on that, you may wish to include key persons or key events that helped shape you in this journey.
Okay, thank you. I guess just a brief story about my journey. I received my PharmD in 1972. So as a P1 student in 1968, we were told in school, in the future, physicians are going to diagnose and pharmacists will prescribe drug therapy. But we were working as interns in pharmacies. We knew the reality was not like that. The reality was very different than our idealistic clinical faculty. And so we actually tried not to laugh when we heard that. I worked as an intern in the same independent community pharmacy throughout pharmacy school. And when I started, I was told that if a patient asked a question, refer them back to the doctor, because we don't want to say anything wrong and upset the doctor. You know, is that a wimpy, insecure attitude? Yeah, hopefully we've come a long way from that time. By the third year, I knew I didn't want to do this for my career, and I really wasn't buying the hype about so-called clinical pharmacy. But for my very first API, I was the first student ever to go to a community mental health center in 1971. And it was actually the psychiatrist at that clinic that asked the School of Pharmacy to have a pharmacy student in her clinic. And that was actually Dr. Sally Kaufman, who kind of started this whole thing. That experience just totally changed my perspective, because I saw that caring for patients' medication needs was a viable and a valuable role for a pharmacist. So what did I do with that realization? I could have just gone on and done other APIs, right? But I took a positive action. I manipulated, when it was possible to do that long ago, I manipulated a second 12-week API in inpatient psychiatry for myself. I wrote a proposal for that community mental health center to fund a clinical pharmacist position. There was no such thing at that time. I manipulated, it's probably a strong word, but I manipulated my general clinical residency into a full-time psychiatric residency program. And during my residency, that community mental health center actually funded my position, creating the first clinical pharmacist position ever in San Francisco. And then I took that position after completing my residency. And then in 1974, I accepted a faculty position at USC because USC was interested in creating a psychiatric pharmacy program. both in terms of establishing clinical practice as well as education and research programs. So nothing about that journey was accidental. I found a passion and I actively pursued it.
Wonderful. Thank you very much for that. So what do you believe will be your legacy in 20 years? You already, I believe, have a legacy, but reflecting on your different contributions that has helped advance the pharmacy profession, what are you most proud of?
Well, I think I'm certainly fortunate to have already experienced some of my legacy, I guess. I mean, I see two key contributions that I've been able to make. The first is pharmacist prescriptive authority. Less than 10 years after being told in school that physicians will diagnose and pharmacists will prescribe drug therapy, and we kind of laughed at the time, I actually led a pilot project at USC in the late 70s, exploring if pharmacists could actually prescribe drugs safely. And based on that project and based on about a dozen publications, California was the first state to enact permanent law in 1981 that allowed pharmacists to initiate and modify drug therapy, immunize, order lab tests. The Indian Health Service actually had prescribing pharmacists before this, but California was the first state based on that pilot project data. Today, most states have pharmacist prescriptive authority. So that's one piece that I'm certainly proud of. The second, obviously, is psychiatric pharmacy, essentially creating that discipline. And in 1998, 30 psych pharmacists sat down in Texas and created a national organization of psychiatric pharmacy. And that's CPNP, or College of Psychiatric and Neurologic Pharmacy. So 30 people sat down and created that organization in 1998. Today, that organization has almost 3,000 members and dozens of student chapters. In terms of the future, I think behavioral health is finally being recognized as equal in importance as physical health. So I think psych pharmacy will certainly have an even greater value, and add to that our opioid epidemic that further creates a need for the knowledge and the skills of a psychiatric pharmacist.
Excellent, excellent. So advice for students in their journey as they develop as leaders. And when I talk leaders, I say leaders who help advance the profession. What advice would you have?
I think this is the most important part of our discussion, and that's advice for students. I've been fortunate with a 46-year career now at USC to have interactions with many, many students. I think we don't need students joining our profession who merely accept what is. Rather, we need students who seek what can be and what should be. And so I think, we need to consider status quo. Status quo is doing what's comfortable, thinking inside the box. Great things are possible if status quo is challenged. And my advice would be identify the things that I've identified, 6 guiding principles that certainly shaped my early career. The first is take chances. Grab possible opportunities. The second, don't settle for the status quo. 3, seek situations that will take full advantage of your potential. I always tell students, your second job should be your best one. The first job is the one that's available when you graduate and you've got to eat and you've got to pay back loans. And the first job isn't necessarily ideal. Don't get discouraged because you're going to choose your second job. And that one should be your best job. 4th, challenge authority when necessary. 5, listen to your gut instinct more than your intellectual assessment of a situation, because usually your gut instinct is right. if you just can tune in and find where that is. And finally, 6, ensure your abilities and your degree of self-confidence are balanced. You know, if your self-confidence is too high, more than your abilities, you're in big trouble. What is our best hope for the continued advancement of our profession? And I think it's our students and our young pharmacists. It's not pharmacy organizations. Too often, they're merely protecting status quo. It's not the boards of pharmacy. They're often too silent on key issues that need change. And I'll cite 2 examples quickly. One is we have archaic patient counseling laws and regulations on the books that were enacted in the 1990s. They're still on the books, and boards of pharmacy really haven't addressed updating and focusing on what kind of patient counseling is really most appropriate. Second is supposedly boards of pharmacy are all about patient safety. But I think today we're seeing patient safety compromised by chain pharmacies due to inadequate staffing, due to time pressure to fill prescriptions. Boards of pharmacy are not leading the profession. It's going to be students and young pharmacists who do that. We have plenty of room at the top of our profession for innovative, creative students who want to make a difference. Or not the nice way to put this, the bottom half of our profession is filling up kind of fast. But what I want to see is students who are ready to jump in, jump to the top of their profession, practice at the top of their license. You know, we don't want people who just want to pass the NAPLEX exam and get their license. We want people to be practicing definitely at the top of their license. So my advice, stay alert to what bothers you about your profession, and then actively be part of that solution.
Excellent. Lots of good words there. So finally, as this is will be embedded in a history course as well, you know, we'll study the decades of the 2020s, and in that decade, there's no doubt that the COVID-19 pandemic will be a key event in this decade, like other events that have shaped our history. How do you see this shaping our history, and in particular being an opportunity for our profession?
Well, certainly COVID-19 is a major healthcare crisis, and we should have a role. Pharmacologic treatments are being rapidly tested, vaccines are being developed. So very soon, hopefully, there will be a great need for vaccines to be administered and a great need for treating both acute and long-term health consequences of the virus. That speaks to where pharmacists can plug in and be part of and participate in the care of millions of patients. Pharmacists especially, I think, can play a key role in patient education around the virus and around its treatments and vaccines. We need to help patients sort through the onslaught of online and otherwise information about drugs and vaccine information that's completely confusing. We should be and can be the source of unbiased drug information.
Mm-hmm. Excellent, excellent. And how about in your area of psychiatric pharmacy? Do you see any particular opportunities that this may be creating?
Well, certainly we've seen discussions about issues like suicide, about depression skyrocketing in some settings, issues of potential more child abuse and domestic violence. The fact that, you know, people have been isolated at home magnifies all of those difficulties. So behavioral health has really risen to the top as equal in importance to physical health issues. Mm-hmm. So psychiatric pharmacy, I think, is positioned very well to participate in that process.
Excellent. Excellent. Again, it's been my pleasure. Thank you very much, Dr. Stimmel.
Certainly. Thank you.